Thank you very much, and as I said earlier, it's a delight to be here. I'm such a supporter of our senior living community and especially of this association. The Florida Senior Living Association has done so much to represent each and every one of you, and most importantly, the seniors that you represent. So thank you. I've been involved in children's issues as well as senior issues. I kind of go on, two sides of the spectrum. Having 8 grandchildren, I kind of look on the younger side as well as the senior side. But I have been very involved in really trying to make sure for our medically complex children. These are children who really would most likely be in nursing homes, and we want to keep people in the least restrictive environment that they can be in, and especially children. We don't want them in nursing homes. So we have a CMS, Children's Medical Services, that provides health care for our medically complex children. And this bill is really geared to help provide for the care of them as carefully as possible. And what we wanted to do was to allow parents to be paid caregivers. We did a bill a couple of years ago. We had to get some different, we had to get a federal waiver from Medicaid in order to do this. And we wanted to make sure we set the parameters very carefully so that we would make sure the children were getting the very best care they could. So what this bill does is it allows parents to be the caregivers for up to 8, and in some situations, 12 hours a day with a maximum of 40 hours a week. So that with the training that the home health agency must provide through licensed nurses, they are able to have the very specific training for that child. So if they have a trach or tube or whatever, they know how to change it. They know how to clear things. Whatever the situation is, whatever the training the care that child needs, the parent would be able to provide that services. It was complex to make sure we had it worded exactly right so that we could get the federal waiver to do it, and that we would have the resources to be able to pay them. We are really looking at how we can provide the very best care for children who have these extremely difficult medical situations and keep them out of nursing homes. We have a great shortage of nurses in the state of Florida. We have a whole major problem with home health care and adequate number of people to serve. And when you need 24 hours of care in the home, it can be very difficult to keep those positions filled. So this is one of the mechanisms that we hope to use to really make sure those kids get the very best care they need. Just like you work with your seniors to make sure that they have the best living situation that meets their needs. And that's what we want to do for kids too. So thank you.